NEHI is a 501c3 nonprofit organization. Our earliest roots were in 2005. It started as a economic development effort, and it was actually put forward by the Omaha Chamber of Commerce and the University of Nebraska at Omaha as an economic development opportunity. Their initial thought was to develop a common electronic medical record across the state of Nebraska. They soon came to realize what an impossible task that would be, even for the state of Nebraska. So with that, a business plan was written, and they began to explore what is now known as the hybrid federated model. But what I want to give them kudos for is the fact that from the very beginning they talked about statewide health information exchange. This is in 2005, 2006, and it was before I was involved with the project. So I'm very proud to say that they were truly visionaries around the table in those early days. From that, a decision accelerator was hosted by one of the health systems in March of 2007. They'd been working diligently, but things seemed to stall, and they weren't quite certain what direction to go. So we held this 2-day strategic planning session, and it was attended by over 100 individuals from across the state of Nebraska, and kind of reignited the spark. And at that point, I became involved as a consultant to the project, and we started with rewriting the business plan, and then took the pieces of an RFI and went forward with an RFP for vendor selection. We did vendor site visits with not only the board of directors, but the CEO of the major health systems in the pilot area, which was Omaha, Nebraska. And I'm proud to say that we did get all of the CEOs on an airplane. Many people ask me, how did you get them all at the table? And also want to give credit to the CEOs of those institutions. They said that this is what's best for the patient, this is what we need to do in Nebraska. So we have moved forward with that. As I said, we're 501c3, we're managed by a board of directors. We announced statewide implementation in July of 2009 and designated by the governor as the statewide integrator in that same year. We've always been public-private collaboration, and we've had very good business minds at the table as well as healthcare leaders. So with that, we have developed several strategies for revenue generation sustainability. One of them is we are offering clearinghouse functionality through the statewide health information exchange. We are working to develop a cybersecurity program where we work with all the participants to help them do due diligence so that they all are comfortable in the fact that they have the right kinds of policies and procedures in place for risk mitigation, and that we also help them determine what kind of insurance coverages they should have for each of their organizations. We're excited because we're working with a couple of insurance carriers that are talking about reimbursing using the HIE to deliver the consulting and then reimbursing the stakeholder for those kinds of services, so it's a win-win for all. Another area that we're working on is HIE advisory consulting. NEHI has already established a subsidiary, HIO Shared Services, and we're working with other states in those early stages, helping them get through privacy, security policies, governance models, and then helping them determine what kind of technology is best for them. Another area that we're exploring is the medication history and alert system through the statewide health information exchange, similar to a PDMP. One of the most frequent comments from the physicians that use NEHI is that it's just been a great tool for drug seekers, and Nebraska does not have a prescription drug monitoring program in place. So a senator approached us about using NEHI to do this. So we are putting together the pieces to offer that through the statewide health information exchange, through medication history, but we're going to offer that as an alert rather than a query, which is different from most prescription drug monitoring programs. We felt from the early days that it was very important that we deliver value to the physicians early on. So we came up fully functional and began to work with the physicians to make certain that we were delivering the kinds of services that they needed. We gathered physician testimonials. Harris Frankel, the chair of the board of directors of NEHI, has been our physician advocate and has just done a wonderful job of encouraging and enlisting other physicians to become a part of NEHI. As far as that value add, we look at each stakeholder segment and look to see where it is that we can deliver value to them. For instance, health systems, the Health Information Exchange can work with them to be a data cleanser, if you will. We work with each of the health systems with the matching of the records, and they find us to be a very valuable partner in that regard. Some of the other areas that we can deliver value is just in the exchange of information to not only the private practitioner but the hospitalist and also health system employed physicians, so that many times they tell us that they use NEHI to find the information faster because they always know where it is within NEHI, and when they're using multiple EMRs, sometimes it just slows them down and they can go right to NEHI and get that information. Some of the challenges that NEHI is facing, and I think it also goes back to the entrepreneurial skills that we have within the organization. So many ideas are coming at us so fast, where the challenge is to focus on what we can do best and deliver quickly and yet not miss any opportunities. We're also working with a number of other RIOs and states to help them get up and running, and it's definitely a resource challenged market, so finding those that we can do knowledge transfer with quickly to get them up to speed so that we can help others. Those are some of the greatest challenges that we're facing, as well as the common ones. We are the statewide integrator. I think we're going to have some pretty exciting announcements here shortly about some other health systems that are joining us that will complete the I-80 exchange, and so we work, and then finally physician adoption as we go west and we get into the more rural areas. There's some broadband access issues. It's a challenging, but the rewards are well worth every day of challenge. We're starting to see it happen in Nebraska already, that we initially were focused on physician adoption, but as consumers become more engaged and begin to understand what this means and how it impacts their health care, they become pretty passionate voices. Nebraska is an opt-out state. We've been tracking those numbers since we went live. We're considered pretty conservative in Nebraska. We've tracked that opt-out rate. It's been anywhere between 1.5 to 2.5% of the population. What else is interesting about that, as we have gone west, such as Hastings, North Platte, Nebraska, I'm sure you all know those communities, we do full-blown consumer education campaigns, billboards, newspapers, radio interviews, Chamber of Commerce presentations, Rotary clubs. We work with the health system marketing department, and we had an individual that early on was very good at developing a robust marketing plan. We've taken that template and gone to each new community as we go. In one of the communities, we had a total of 8 individuals that opted out in the first 2 weeks. In another community that we brought up, North Platte, they actually had individuals that heard the ads and were calling into the hospital saying, I don't know how you get to be a part of NEHI, but I want to come in and sign up. So I think when you're talking about a very conservative state that Nebraska is usually considered to be, and you have that kind of physician engagement, we're pretty passionate about that, and We have individuals that are asking their doctors, are you a knee-high participant? We have doctors that are telling their patients, you know, if you've opted out, I'm concerned about the level of care that I can give you because it's important to me that I have all the information at the point of care. So it's a lot of people are working together, rolling up their sleeves and figuring out how to do it. But if you ignore that consumer, I think you're missing a wonderful opportunity. Once again, Nebraska has been extremely fortunate in that the CEO of the major payer, Blue Cross Blue Shield of Nebraska, has been very involved and very passionate about the necessity for health information exchange to deliver quality care to patients. Was involved from the early days in 2005 and has made significant contributions both of time, resource, connections to find information. We've just been extremely fortunate to have that kind of a participant at the table working with us and making certain that we understand both sides of the equation, clinical and administrative, and where the benefits can be made and gained by working together through the continuum of care. We're currently working with the State Public Health Lab. We're testing immunization data. We want to go to disease reporting, disease surveillance, public health reporting, and then as we go into the community, of course, there's always the federally qualified health centers. We're having beginning conversations with them, and again, that ties into the Medicaid picture. And currently, we are not yet connected to Medicaid. We're just getting ready to work with them on a patient-centered medical home pilot. So we are exploring a number of different avenues. PHR, with the implementation dollars that we received since our operational plan, strategic and operational plans were approved on December 10th, yes. Part of that functionality is the PHR gateway. Again, we're pretty passionate about involving the consumers, and they're waiting, so we want to make certain that we deliver on that promise and that functionality. I think one of the most positive and rewarding experiences when I meet with others on the national scene is that we are all about rolling up our sleeves, getting it done, sharing information, the collaboration that I see from a number of different states and their willingness to offer up best practices. Hats off to all of us that are working so hard and so diligently to make this happen. It truly is an opportunity that this country has probably never seen, at least in recent history, and hats off to the pioneers that are out there making it happen.